Hello guys, my name is Lyman, a Sapon, a student nurse from Isabela State University, Section 2B. Today I will do the written demonstration about cleaning the wound. For us to understand what we're going to do today is let me tell you the purpose of wound care. First, to promote wound healing by primary intention. Second is to prevent infection. Third is to assess the healing process, and the fourth one is to protect the wound from mechanical trauma. So let us now proceed to the equipment needed in performing the wound care. This is the equipment that I prepared for the wound care. And now we were going to do the different procedure in performing the wound care. First, prepare the client or the patient and assemble the equipment. And acquire assistance for changing a dressing on a restless, confused adult. This person might move and contaminate the sterile field or the wound. Second is assist the client to a comfortable position in which the wound can readily be exposed. Expose only the wound area, using a black bath blanket to cover the client if necessary. Undue exposure is physically and psychologically distressing the most people. Place the bag within reach. It can be taped to the bedclothes or bedside table for us to prevent contamination. Put on the face mask to prevent contamination of wound by droplet spray from the nurse respiratory system. So I already wear my face mask. Since the wound of the patient is located in the hand of the patient, we assist the client to the comfortable position in which the wound can readily expose. And now we're going to perform the second step, which is remove the binders and tape. Remove the binders if used, and place them aside and untie the tape is used. If adhesive tape was used, remove it by holding down the skin and pulling the tape gently but firmly towards the wound. When possible, remove the dressings in the direction of hair growth. Use a solvent or moistured cotton to loosen tape if required. Moistening the tape will help to lessen the discomfort of removal, particularly the hairy surface. And now, we're going to remove the dispose of soiled dressings appropriately. Put on clean disposable gloves and remove the outer abdominal dressings or surgical pad. Outer dressing so that the underside is away from the client's face. Place the soiled dressings in the moisture-proof bag without touching the outside of the bag to avoid the spread of microorganisms. And next, remove the underdressings, taking care not to dislodge any drains. If the gouge is stick to the drain, support the drain with one hand and remove the gouge with the other. Assess the location, type, color, and consistency and odor of the wound drainages and the number of gouge saturated or the diameter of drainage collected on the dressings for us to document all the data for future comparison. Discard the soiled dressings in the bag as before. Remove the gloves, dispose of them appropriately, and wash hands. And now, I'm done in removing my gloves, and then I will wash my hands. After removing my gloves and washing my hands, and now I am going to do my hand hygiene. I will put an alcohol in my hand, and after that, set up the sterile supplies. Open the sterile dressing set using surgical aseptic technique. And then, place the sterile drape beside the wound. Open the sterile cleaning solution and pour it over the gouge sponge in the plastic container. Put on sterile gloves. Clean the wound using your gloved hands or forceps and gouge swabs moistened with cleaning solution. Use the cleaning method recommended by agency protocol. Use a separate swab for each stroke and discard each swab after use. Move from the least contaminated area to most contaminated area. This prevents the introduction of microorganisms to other wound areas. Apply the ordered ointment. Use sterile application or tongue blades to apply ointment. And now I already put the ointment on the wound. Place the gouge pads or packing tape in the wound. Carefully fill in the wound and any spaces under the skin. This is the sterile glove swabs. Apply the sterile dressings one at a time. Use tape or rolled gouge to hold these dressings in place. This is the tape. Now, we're done in putting the sterile dressings in the wound of the patient. After putting the sterile dressings in the wound of the patient, put all the used supplies in the plastic bag, close it securely, then put it in a second plastic bag and close the bag securely, put in the trash. I will remove also my gloves and place on the plastic bag. And place on the trash. After putting the used supplies in the trash, wash your hands again when you are finished. Document the procedure and all nursing assessment. And that's how I perform the wound care of the patient. Thank you.